Greetings, and thank you once again for spending a few minutes to learn what's going on at FHN. Today I'm joined by two really important individuals who oversee the operations for all of our practices. So those are our physician clinics throughout all of our rural communities here in Freeport, and their jobs are to ensure that the operations are done well and that they are very safe places for us to be able to not only receive care, but also for our team to be able to provide care. So joining me are Kathy Stauffer and Josh Heim, and they're going to be talking to you a little bit more about some of the things that we're doing to ensure everybody's safety.
I have the opportunity to oversee and collaborate with our satellite offices, which cover 5 counties: Savannah, Mount Carroll, Lanark, Stockton, Warren, Lena, Orangeville, Pecatonica, Forreston, Community Health Care Center that is housed at the Stevenson County Health Department, along with the Stevenson Clinic here in Freeport and the Harlem Building, and those offices include neurology, ophthalmology, and pulmonology. We are seeing, as we are moving through this pandemic, an increase in patient visits. We are now seeing patients that are coming in besides concerns with COVID-related illnesses. We are seeing more preventive referrals that are coming from the primary care to the specialty, and also some of those routine exams for those chronic disease management, such as diabetes, hyperthyroidism, hypertension, or lab work. Our offices are open, and we do have some extended services. So if patients are interested in having an appointment at 7 a.m. in the morning, or schedule an appointment for some Saturdays in our Lena, Forreston, or coming up in July, Pecatonica offices, we can accommodate those needs also. As we've moved through this pandemic, we have identified great opportunities here at FHN. And Josh and I have been working with our centralized scheduling department on a new process. Now when patients call the office to contact their primary care provider or their specialist office to contact their specialty provider, they will receive or be intercepted by our customer service scheduling department, and they can accommodate their scheduling needs. Previously, we were seeing COVID patient or COVID-related medical necessary appointments that were deemed by the provider. Now, as we're starting to move into our phase 3, we're starting to handle more of those preventive visits, those referrals that the primary care physicians wanted the patient to see their specialist, or chronic management, going back to diabetes, hypertension, lab work. So basically moving forward with some normalcy in our practices. Offices are asking patients to please reach out and contact your provider. This allows the staff to triage the patient to see what would be the best access point. If the patient is suffering from any type of COVID illness, they can be either triaged through our telehealth visits by some of our providers, or they can be sent on to our emergency room or physician immediate care, or brought into the office. But we want to make sure that we are honoring our social distancing. Patients are provided with a mask, and we're trying very hard to keep our staff and patients safe and escort that patient to the room. So we ask that you please call ahead. FHNow is a service that is available to FHN patients or non-FHN patients. If you visit FHN's website at www.fhn.org, it is a very easy process to be evaluated by a non-FHN physician, either for an acute illness, by telephone, or by video. We like to utilize FHNow if it is after office hours and you're unable to see your provider, or during this pandemic time, if you're uncomfortable coming to the office, it's another access. Staff are very excited to see patients. Actually, it's quite a joy. As you walk through the buildings and you're seeing patients return for their visits, staff are encountering them and they're reuniting, and just the warm greeting and the welcoming environment. We want to keep everyone safe, our patients and our staff, but we're so glad to have them coming back and turning back to our normal day here at FHN.
Currently, I oversee Burchard Hills and Highland View Drive here in Freeport. We have just recently entered into phase 3 of bringing back patients to the clinic. Appointments are going steadily well and increasing each week. In Burchard Hills, there are 9 different departments in a multidisciplinary facility. We have an array of different appointments that are being seen. We have recently opened up to seeing all patients, but we are staggering those times and making sure that we are adhering to our social distancing, allowing just so much volume through our doors at a time. Our overall goal to get somebody in through our doors pre-COVID was 72 hours. Obviously, as we come out, there's a lot of patients that appointments have been canceled that we're working diligently to get rescheduled back in to see their provider. As the provider schedules fill, we are offering patients that need to be seen sooner than later, other providers that have opportunity to see those patients, but our overall goal, yes, is 72 hours to have that patient be seen by a provider within the facility. Upon entering the facility, you'll see a lot of changes that have occurred. First, we've had spacing put between the check-in desk so that social distancing does remain between the staff and the patient. Our waiting areas, the seating has been completely rearranged and some of the seating removed to also encourage folks to keep their social distance between each other while waiting for their appointments. You will have masks offered to you as come in if you do not possess one. And we are also still encouraging, if you're able to attend your appointment, to attend it alone. If somebody is needed to come, that is fine, but we're still having those visitor restrictions. During the pandemic, we were able to establish telehealth as another option for access for our patients in the community. This is something that you would like to see if it is offered. We encourage you to call in and see if you can get that scheduled. Yes, the staff is very eager to welcome the patients back again to our clinic. I feel that not only are the staff, but the patients themselves are eager to get back to some normalcy back in their lives. And we are open and ready to take them in to see their providers as soon as they are ready to give us a call and get scheduled.
Well, there's always many new things going on at FHN. We're pretty excited about the community's opening to restore Illinois and phase 3 once again. So many of us are able to resume some of the normal things that we've done in the past, such as getting haircuts or being able to go out and meet into groups that are less than 10. So I know that a lot of us are looking forward to that. But at FHN, we are still following guidelines recommended by the Illinois Department of Public Health for visitor safety and for patient safety. So some of the things with phase 3 that have not changed at FHN is our need to make sure that we're ensuring everybody's safety throughout their entire care journey. One of the things that is a little bit more different, or that we've increased from last week, is the ability to do more cases, so more elective cases and more procedures. So we're able to welcome our community even at a greater number than we were doing the prior week. So we continue to grow and expand with our offerings and welcome everybody back into our doors. Unfortunately, we have had some of our FHN staff members that have been diagnosed with COVID-19 as positive. I'm grateful that it's a very small number, but no matter how small that number is, it's still part of our FHN family. And it makes us all take a step back and realize how serious this is. And many of our healthcare heroes, whether they be physicians, respiratory therapists, nurses, or other professions, are really putting themselves in front of COVID-19 and protecting our patients the best they can by treating them. So it's a hard thing for us to accept that the very people that are caring for those that are most ill are putting themselves at risk. But once again, it's been a very small number, and I'm grateful for that. When we look at the actual number compared to FHN staff, it's just over 1% to date that we've been exposed and have had a positive test. So we're hoping for quick recovery. Some of them have already recovered with no major adverse outcomes and are already back to work. Our electronic intensive care unit is not new to COVID-19, and many of our community members know that already. In fact, we're celebrating our 10-year anniversary of working together with the University of Wisconsin for some of the first in the nation as being an EICU, or an electronic intensive care unit. Matter of fact, I believe we were in the first 10% of the nation to adopt an EICU. And what this has allowed us to do is to make sure that we are working directly with intensivists, specially trained physicians that are very focused on intensive care medicine, that are helping to coach our physicians and to coach our nurses in the care for all of our family members in the intensive care unit. That allows them to stay closer to home so that friends and family can help support those individuals. And again, it reduces the stress of having somebody being hours away for this level of intensive care. So we're pretty excited about that, and working together with University of Wisconsin has also helped us in our COVID-19 response and successful treatment for these patients. I certainly hope that the numbers continue to go down and that we don't see a big surge. We are expecting to see another wave of activity probably this fall, but that's something that's yet to be determined. I think it really is encouraging to see that some of the measures that have put in place are working. The better weather should hopefully help us, but we also have to be careful, remain cautious, and while we're all excited about moving forward in phase 3, we certainly want to try and get to phase 4 without any delay and not necessarily have to step back. So we remain cautious, but again, it's a good thing to see the number of cases going down and our positivity rate overall decreasing. As many people return back to work or return to outdoor dining, it's important to remember that we still have to be cautious and we have to take care of each other. Again, we want to make sure that we're continuing our progress in defeating the spread of COVID-19, and that takes good common sense. So it's making sure that we do adhere to that social distancing, wear masks when social distancing is not possible, frequent hand washing, and once again, just engaging in those safe practices, enjoying some of the new things that we're able to enjoy since our shelter at home. But also keep in mind we want to do that with everybody's safety in mind, so we don't have to go back a phase but keep moving forward. So let's enjoy it, let's support local, get out there. It's a beautiful time of the year to enjoy our area, and let's make the most of it safely.